Your zip code predicts how long you'll live more accurately than your genetics do. Two people, same city. One lives downtown, one lives 5 miles away in a different neighborhood. According to research from the CDC and the Robert Wood Johnson Foundation, those two people could have a life expectancy gap of 10, 15, even 25 years, just based on where they live. That's not a medical problem. No doctor can fix that. That's a public health problem, and understanding the difference changes everything. When most people hear public health, they picture hospitals, nurses, doctors, maybe a vaccination clinic. That's healthcare, and healthcare matters. But public health is something different, and the confusion between the two costs lives. Healthcare is reactive. Someone gets sick, you treat them. Public health is upstream. It asks, why are people getting sick at all? And more importantly, what can we change in the environment, the policy, the system, so fewer people get sick to begin with? If healthcare is pulling drowning people out of a river, public health is walking upstream to figure out why they're falling in. That metaphor is actually taught in public health programs around the world, and once you see it, you can't unsee it. Let's talk about seatbelts. Before the 1960s, car crashes were killing tens of thousands of Americans every year. Doctors were treating injuries, but public health researchers asked a different question. What if we change the car, change the road, change the law? Seatbelt laws, crash standards, airbag requirements. These weren't medical interventions. They were policy interventions. And they've saved over 3.5 million lives since 1975, according to the CDC. No prescription required. Water fluoridation. In the 1940s, dental decay was one of the leading causes of missed school days and military rejections. Public health researchers noticed that communities with naturally higher fluoride in the water had dramatically lower rates of tooth decay. By 1945, the first community water fluoridation program launched in Grand Rapids, Michigan. The CDC named it one of the 10 great public health achievements of the 20th century. Nobody prescribed fluoride to individuals. It was added to a shared resource, the water supply, and an entire population benefited. That's the core difference. Public health operates at the population level. It doesn't ask, how do I treat this patient? It asks, how do I shift outcomes for an entire community? Smoking bans, vaccine campaigns, mandatory nutrition labels, speed limits, lead paint removal, seatbelts. These are all public health wins. None of them required a doctor's visit. All of them required research, policy, advocacy, and sometimes decades of fighting industry resistance. That's actually one of the field's biggest challenges. When public health works, nothing happens. No outbreak, no epidemic, no crisis. And it's hard to fund and celebrate the absence of disaster. Here's a real scenario. A woman in her 40s is diagnosed with type 2 diabetes. The healthcare system treats her, prescribes medication, gives her dietary advice, sends her home. She lives in a neighborhood with no grocery store within 2 miles. The nearest food options are fast food and a corner store. She works two jobs and doesn't have a car. No amount of medication fixes the underlying problem. Her health outcome is being shaped by forces that have nothing to do with her individual choices: income, transportation, food access, housing, neighborhood safety. These are called the social determinants of health. The WHO defines social determinants as the conditions in which people are born, grow, live, work, and age. The CDC and Healthy People 2030 both identify them as the primary drivers of health disparities in the United States. According to the Robert Wood Johnson Foundation, zip code is a bigger predictor of life expectancy than genetic code. In some counties, two census tracts, just miles apart, show life expectancy gaps of over 16 years. That gap isn't random. It's the result of decades of policy decisions, where highways were built, where investments were made, which neighborhoods got good schools and which didn't. Public health is the field that studies those patterns and tries to change them. So what does a public health career actually look like? Because it's not just epidemiologists tracking disease outbreaks, though that's part of it. Public health professionals work in city and county health departments designing community programs. They work in nonprofits and advocacy organizations pushing for policy change. They work in healthcare systems, improving operations and reducing disparities. They work in emergency management, coordinating disaster response. They work in research, communications, environmental health, maternal and child health, behavioral health, and global health. The field needs people who understand data, people who can communicate, people who understand communities, people who can run programs at scale. If any of that sounds like you, public health is worth a serious look. Every week on this channel, we break down educational topics, the systems, the policies, the research, and the careers in plain language. No textbooks, no jargon without explanation, just the stuff that actually matters and why it matters to you. Thanks for watching.